In this video, we will talk about folate deficiency. Let's start with the difference between folate and folic acid. Folate is a natural form of vitamin B9 in food, and folic acid is the synthesized form of folate present in fortified foods and supplements and has a higher bioavailability than naturally occurring folate. The body has about 1,000 to 20,000 microgram of folate stores, and adults need about 400 microgram per day to replenish the daily losses. Folic acid is a B vitamin, it's B9, and it helps your body to make red blood cells. Folate is an essential water-soluble vitamin naturally present in foods, especially in fruits, green leaf vegetables, and liver. We will talk more about this later on. Folate has been added to grains at 1998 in the United States to prevent congenital disabilities, especially neural tube defects such as spina bifida. Folate deficiency can cause anemia. Anemia is a condition in which you have too few red blood cells. It can deprive your tissues of oxygen it needs because red blood cells carry the oxygen. This may affect their function. So, folate deficiency usually causes macrocytic anemia, which is a condition in which your body has overly large red blood cells and not enough normal red blood cells. Macrocytic anemias are caused by a lack of vitamin B12 and folate, generally. So folate is rapidly depleted. It takes 4 to 5 months, and it's the most common cause of macrocytic anemia, whereas vitamin B12 takes much longer to become depleted, usually 4 to 5 years. Symptoms you can see with folate deficiency: extreme tiredness, lack of energy, pins and needles, paresthesia, sore and red tongue, gray hair, mouth sores, reduced sense of taste, and diarrhea. B12 and folate deficiency can present very similar way. Symptoms alone not enough to differentiate. Many times these can occur together, but I will tell you some signs of vitamin B12 deficiency. These are mainly neurologic. You can have changes in the way that you walk and move around. You can have disturbed vision, irritability, depression, changes in the way you think, feel, and behave, and a decline in your mental abilities such as memory, understanding, and judgment. So now we will talk about the good sources of folate. We have broccoli, Brussels sprouts, leafy green vegetables such as cabbage, kale, spring greens, and spinach. We have peas, liver, breakfast cereals fortified with folic acid. A diet low in fresh fruits, vegetables, and fortified cereals is the main cause of folate deficiency. In addition, overcooking your food can sometimes destroy the vitamins. Deficiency is common in the elderly who sometimes subsist on tea and toast diet. In these patients, we can see hyponatremia, a low concentration of the electrolyte sodium in the bloodstream due to lack of salt in the diet. You can reach our hyponatremia signs video from the links down below, also top right corner. We have some vulnerable groups that can have folate deficiency, and those are alcoholism. Alcoholic patients usually have both B12 and B9 deficiency. Some gastrointestinal diseases, for example, inflammatory bowel disease, ulcerative colitis, and Crohn's disease. We have celiac disease and short bowel syndrome. Also, pregnancy can cause folate deficiency. Cancer patients can have folate deficiency. Certain medications can cause folate deficiency because they can impair the absorption or inhibit the physiologic effects of folate. And some of these are trimethoprim sulfamethoxazole, also known as Bactrim, which is an antibiotic. We have methotrexate, which is used for rheumatoid arthritis and cancer. We have sulfasalazine, also known as azulfidine. And lastly, we have phenytoin, also known as dilantin. Folate deficiency presents with a megaloblastic anemia. What is megaloblastic anemia? In this condition, our red blood cells are larger than normal and not fully developed. Although the deficiency can present with similar findings to vitamin B12 deficiency, it does not cause neurological deficits. B12 deficiency will cause neurologic deficits most of the time, but in folate deficiency, we don't have any neurological deficits. It's important for us to treat vitamin B12 or folate deficiency anemia. It should be diagnosed and treated as soon as possible. Although many of the symptoms improve with treatment, some problems caused by the condition can be irreversible if left untreated. The longer the condition goes untreated, the higher the chance of permanent damage. Now we can talk about the treatment. Treatment involves increasing the dietary intake of folate. You can also take folate or folic acid supplements. Pregnant women should completely avoid alcohol, and everyone else with deficiency should decrease their alcohol intake. Lastly, I want to say one thing that is important. Prior to starting folic acid for anemia, B12 deficiency must be ruled out first, because if you treat vitamin B12 deficiency with folate, neurologic deficits can be precipitated or worsened. So that was the end of the video. Don't forget to like, subscribe to our channel, and you can join our channel membership from the links down below. See you later.